Assalamu alaikum warahmatullahi wabarakatuh. Hi everybody, welcome on rotator cuff muscles. Let's start with definition. Rotator cuff muscles are four muscles and their tendons important in stabilizing the shoulder joint. This can be numbered by mnemonic sets SITS, supraspinatus, infraspinatus, teres minor, and subscapularis. Shoulder joint is known as the most mobile joint of human body. This provides wide range of motion and allow for numerous function, but it comes on the cost of stability, which lead to shoulder dislocation as a frequent problem in shoulder joint. First muscle in this group is supraspinatus. We will talk about origin, insertion, action, nerve supply and blood supply, and the important relation with this muscle. Supraspinatus muscle originates from supraspinous fossa of the scapula above spine scapula here and inserted in greater tubercle of the humerus. So when this muscle contracts, it initiates abduction. Abduction is a complex movement of the shoulder joint. Our muscle here initiates this movement. Second function, and the common function in rotator cuff muscles, is stability of the shoulder joint. This muscle is supplied by suprascapular nerve, which supply supraspinatus and infraspinatus. Blood supply comes from suprascapular artery. We will talk about important relation here. Muscles responsible for Subacromial Bursa of shoulder joint. Initiation of abduction from 0 to 15 by supraspinatus muscle, from 15 to 90 by middle part of deltoid muscle, for above 90 by serratus anterior and trapezius. This is done by gliding movement of scapula over thoracic cavity. Subacromial bursa, which we mentioned before, is an important structure related to supraspinatus muscle. It extends laterally from greater tubercle, where most rotator cuff muscles are inserted, anteriorly to overall intertubercle groove, medially to acromioclavicular joint, posteriorly over rotator cuff. Subacromial bursa is inflammation of subacromial subdeltoid bursa, which leads to inflammation in this muscle lead to shoulder pain. It is one of the commonest cause of shoulder. Infraspinatus is the second muscle in cuff muscles. It originates from infraspinatus fossa of scapula and inserted in greater tubercle of humerus. This muscle is responsible for external rotation of humerus and also stability of the shoulder joint. It is supplied by suprascapular nerve, which supplies supraspinatus. Blood supply comes from suprascapular and circumflex scapular. It is related to infraspinatus bursa. Suprascapular nerve, which supplies supraspinatus and infraspinatus, arise from upper trunk of brachial plexus. Brachial plexus have three trunks. Suprascapular nerve, our nerve here, arise from upper trunk. It supplies supraspinatus and infraspinatus. This nerve is liable to compression when we hold back for prolonged time, lead to compression. There is two sides of compression of suprascapular nerve in the suprascapular notch and spinoglenoid notch. Teres minor, which is the third muscle in this group, arises from lateral border of the scapula, inserted in also in a greater tubercle of humerus, act as external rotator and abductor of the shoulder joint, and also stability of the shoulder joint. Axillary nerve supply this muscle and also supply the deltoid muscle. Blood supply comes from suprascapular artery to the scapular artery. It forms the model of important triangles and space in the axilla. First space we will talk about is quadrangular space. It has four borders: laterally by surgical neck of humerus, medially by long head of triceps, above by teres minor, and below by teres major. It contains two important structures: axillary nerve and posterior humeral circumflex artery. Second space is triangular space, which is also named medial triangular space, because there is another triangular space in this region. This space is surrounded by laterally by a long head of triceps, and superiorly by teres minor, which is cut here, inferiorly by teres major muscle. It contains minimally important structure, which is circumflex scapular artery. Third space, and an important space, is triangular interval. The last space is triangular space, and this is triangular interval. It is bordered by teres major from above, and laterally by lateral head of triceps, and medially by long head of triceps. It contains profundibranchial artery, which runs from brachial artery, and radial nerve. Subscapularis, which is the last muscle in this group, it arises from subscapular fossa of scapula and inserts in lesser tubercle anteriorly. It is responsible for arm internal rotation and abduction. As for muscles in rotator cuff muscles, it is responsible for stability of the shoulder joint. It is supplied by upper and lower subscapular nerves, and the lateral eye come from suprascapular artery, axillary artery, and subscapular artery. It forms the majority of posterior wall of the axilla.